Welcome. Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuvir Deshpande, would like to welcome you all in my Ayurveda Academy YouTube channel. My dear friends, today's video is a continuation of our Srotas examination, that is Ayurvedic clinical examination. Ayurvedic clinical examination is a very essential part when you want to diagnose with the Ayurvedic perspective of any disease, and then you have to manage that particular disease. Because Ayurveda believes our health and also the pathology is depend on the basic concepts of Ayurveda, dosha, dhatu, mala, and also such concepts like srotas. Srotas is a concept where the tissue metabolic processes takes place, and there are four important events are taking place: utpatti, parinamana, vahana, and utsarjana. Utpatti means creation of that particular element. Utpatti, parinamana, all the metabolic processes related with that element. Utpatti, parinamana, vahana, transport, and utsarjana, excretion of the waste products created at that particular metabolic process. Ayurveda believes that there are innumerable channels, that is srotas, in our body, but the important srotasas are 13, that is prana, anna, and udakava srotas, then saptadhatu, rasava srotas, raktava srotas, up to the shukra vaha srotas, and then also the three important srotasas related with the waste product, that is Mutrava Srotas, Purishavaha, and Svedava Srotas. Srotas can be disturbed in the two ways. Number one, Sroto Vaigunya, and then comes the Sroto Dushti. So, my dear friends, today we are going to discuss about the muscle tissue or Mansavaha Srotas examination. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, my WhatsApp number is 92268 Let us start to discuss the examination in threefold manner. Three steps are important: darshana, sparshana, and prashna. Darshana is inspection, sparshana is a touch, palpation, percussion, auscultation, and prashna is the interrogation or the history taking. First, we will talk about darshana pariksha in a normal aspect. Observe, if you want to test the Mansavaha Srotas, general build of a person, whether the muscles, all the muscles, bicep, tricep, are adequately covering the internal body structure, because the important function of Mansudhatu is lepana. Lepana is a covering, coating, protection. As you know, there are, Bhagavad has mentioned, the Sreshta karma of Saptadhatu, Prinanam, Jivanam, Lepaha, Sneho, Dharana Purane, Garbhotpadascha Dhatunam, Sreshtham Karma, Kramat Smrutam. So best function, top function of Rasadhatu, Prinana. Best function, Sreshta Karma of Raktadhatu, Jivana, oxygenation to give the life. Mausadhatu, Lepana. So here we are checking whether there is adequate covering. Whether the cheeks, these are the cheeks, then arms, then the shoulders, chest, abdomen, thighs, calf, these all the parts are adequately nourished and bulky. Whether all body parts are well nourished and well developed, because that is depend on the muscle or the Mausudhatu, or looking the patient emaciated, very lean, that is a Mausudhatu Kshaya. Weight loss is a Mausudhatu Kshaya, deficiency of Mausudhatu, because your weight is depend on muscles, your weight is depend on bones, your weight is depend on fat tissue or the Meda Dhatu. So Mausudhatu is also important dhatu for giving you the proper weight, height-weight ratio. Okay, next, compare my left side and right side of the body, left arm, left thigh, right thigh. Is there any organ or any part which is looking smaller or bigger? Little less or more less than the normal is called as a muscle atrophy, Mausudhatu Kshaya. Or if it is bulky, over than normal, that is hypertrophy of the muscle, Mansudhatu Vriddhi pathological. For this, what you have to do, you have to do the measuring tape measurement. Suppose I want to check these arms, right and left, then check the circumference of this part, circumference of this part by the measuring tape and compare it. Then you will immediately get the idea. Are there any symptoms of muscle wasting? that is Mansa Dhatu Kshaya Lakshana, clinical features. For example, weight loss may be there, body thinning may be there, prominence of all the bones, sunken eyes, sunken cheeks. Cheeks go inside. Huh? Okay. Visible tendons of the hands and the feet and a hollowing going inside of the abdomen. This suggests that your muscle tissue, Mausa dhatu, is having deficiency, emaciation, weight loss. Next, are there any symptoms indicating muscle tissue impairment or damage, which is called as a Mansavaha Srotas Dushti Lakshana in Ayurveda? Some Sanskrit words are there. Mausa dhatu, Mansavaha Srotas Dushti Lakshana. For example, weakness because of the weight loss, emaciation, muscle atrophy. There may be fibrosis, scar tissue formation. There may be contractures of the muscle tendon, joint stiffness will be there. Is there in the body any permanent contraction of muscle tissue? Contracture can occur due to the chronic arthritis. Are there any deformities in the muscle tissue due to malnourishment, less blood supply, ischemic changes, or undernourishment that can take place as a part of gangrene or putti Mansa word in Ayurveda? Now next, after darshana, sparshana, touch, muscle tone, which Sanskrit word is Sanhanana Pariksha. Sanhanana Pariksha in Ayurveda. Muscle tone assessment is very important. Muscle tone, what is muscle tone? It's a natural state of tension, or resistance of muscle during the rest. Muscle tone can be evaluated. How to determine? Just do the palpation, okay, which involves assessing the firmness or resistance felt upon touch. There is video, my video is there. Nervous system examination. Please. 3 videos are there. Nervous system examination. First is a general intelligence and all the cranial nerves. Second part, motor system examination. Sensory system examination. Third part, motor system. You will get all these muscular examination part in the nervous system examination, third part. Please check that video. That maybe I have put that particular card over there. You have to just click and check that video. Okay. Then muscle tone can be assisted by instrument like electromyography to assess the contractility and tone of the cardiac muscle. Electrocardiogram ECG can be used to visualize the contractility of the muscles, visceral muscles of the gastrointestinal tract. Procedures like, for example, barium meal swallow. Barium meal swallow X-ray may be helpful because it can show the peristalsis and filling defects. In conditions of upper motor neuron lesion, hypertonic muscles are very common. In the lower motor neuron problem, there may be hypotonicity. What is upper motor neuron? The nerves from the brain to the spinal cord, that is upper motor neuron. And from the spinal cord to the hands and legs, that is lower motor neuron. Upper motor neuron problem is hemiparesis, hemiplegia, and lower motor neuron problem is poliomyelitis. Okay, so the muscle tone is very important for this evaluation of UMN, whether the lesion problem is upper motor or lower motor. In UMN lesion, this touch may give a rigid or stiff feeling. When LMN lesion is there, LMN problem is there, it may be little bit soft and flaccid. Okay. Reduced muscle tone can cause pathology. Like, for example, in Ayurveda, in Vata Vikruti, there is the word Vyasa. Vyasa is a dilatation of the any organ, cardiomegaly, for example. And loss of tone also can cause prolapse. Prolapse, that is Sramsa in Sanskrit. Prolapse of the uterus, prolapse of the rectum. This can happen because of the muscular problem, Mansavaha Srotas problem. Next, temperature, touch, hot, cold, hardness, and pressure can also be elicited during the examination of number 1, adhimans, which is called as hypertrophy. Adhimans is a Sanskrit word, Ayurvedic word. Arbuda, malignant tumor. Granthi, benign tumor. Galganda, thyroid swelling. So these are the Sanskrit word Devanagari script. You can read Adhimaus, Arbud, Granthi, Galaganda, Mansavaha Srotas, Dushti Lakshane. Okay. Sparshana Pariksha. Acute abdominal conditions are associated with severe tenderness of abdominal muscle. Sparsha Sahatva. Patient cannot tolerate the touch of the doctor's hand. When you liver press, this is tenderness. Sparsha Sahatva. Acute abdomen or surgical abdomen, for example, perforation, intussusception, volvulus, these are the conditions which can cause severe abdominal pain and which has to be hospitalized and do the surgery as and when necessary. Now, last is a Prashna Pariksha. In order to get a good nutrition of muscle tissue, Mamsa Dhatu, whether you can ask whether the patient is consuming suitable sources of protein, because protein is necessary for the Mamsa Dhatu Vriddhi, normal, Mamsa Dhatu growth, Mamsa Dhatu nourishment, whether the patient is taking lentils, eggs, milk, because it is beneficial, right? Then whether the patient is doing dieting, zero figure, or fasting, because this is not good for the Mansa Dhatu. This is not good for Mansavaha Srotas. Nourishment will not happen. Then you will lose the weight. Next, whether the patient is consuming a diet which involves the process of fermentation. Sanskrit word kinvana prakriya, fermentation, like curdling of yogurt, and using this particular fermented product or the foodstuffs are prepared from this fermentation are like bread, dhokla, idli, uttapam, dosha, all the South Indian type of the food, because this Abhishyandi food, Abhishyandi Aahar, fermented products can not be good to maintain the muscle physiology. It can create a sroto-rodha, amanirmiti. Okay. Regarding the concept of Abhishyandi Aahar in Ayurveda, it refers to the foods that are considered to be heavy to digest, guru, cooling, shita, and potentially mucus forming. Lot of mucus and obstruction. Sroto-rodha will be there. Whether the patient is taking diet which is heavy to digest, that is also not good, such as excessive fatty food or heavy meat consumption. This can disturb Mamsa Dhatu property of Guru, because Mamsa Dhatu is having property Guru or the heavy. Yasya bruhane karmani shaktihi saguruhu. Mamsa Dhatu is a parthiva, that is predominance of earth element. Does patient has a habit of daytime sleep after lunch? Again, this particular diva swap in Ayurveda, diva swap, daytime sleep, can disturb Mamsa Dhatu, because Samanya Vishesh Siddhanta, Mamsa Dhatu is already Guru, so Mamsa Dhatu is a Parthiva, so that will be excess and there can be a derangement in the Mansavaha Srotas. Whether the patient is doing regular exercises, whether he is doing yogasanas, which are beneficial for the muscle tissue, because it can increase the strength of muscle, it can increase the flexibility of the muscle, and also endurance of the muscle, that means Mansavaha Srotas. There are certain occupations or activities which can put strain on the muscle tissue, leading to the development of muscular abnormalities and problems. So you should ask the patient whether the patient is having such type of occupations which can damage Mansavaha Srotas. For example, manual labor jobs, occupations involving heavy lifting, carrying, or repetitive movements can exert excessive strain on the muscles, potentially leading to the muscle fatigue, strain injuries, or musculoskeletal disorders. Desk job like this, sitting on the computer, in front of the computer, like me, with prolonged computer use, sitting for long periods, 7 hours, 8 hours, 10 hours, 12 hours, 14 hours, and maintaining a static posture while working on the computer like this, typing, can lead to the muscle imbalance postural issues, like for example, cervical spondylosis, lumbar spondylosis, and repetitive strain injuries. Next, continuous heavy lifting. Jobs which involve constant heavy lifting, such as the warehouse work or construction type of work, can put significant strain on the muscles, leading to the muscle overuse, fatigue, and potential injuries. Next point, Prashna Pariksha. Khamala. Very interesting. Khamala. Waste product of mouse dhatu metabolism. Certain observations can be made by you, by a doctor. The ear wax, nasal secretions, and eye discharge. These are reproductive secretions are considered as a khamala. Kha means hole, where the waste product is coming through the hole. Okay, that is that khamala is a waste product from mouse dhatu metabolism. Okay, if there is excessive accumulation of these waste products, it may indicate that there is impaired, not good, metabolism of muscle tissue. Next, muscle wasting, also known as the muscle atrophy, can manifest with the different symptoms. So you have to ask the patient about these symptoms. You ask the patient whether there is a general fatigue, weakness, tiredness, even after performing simple routine task. There may be abdominal pain and discomfort. There may be muscle stiffness and joint pains. There may be dizziness or lightheadedness, shiny appearance over the affected muscles, like for example, in the thighs, in the buttocks. Muscle twitching and cramps may be there. Next, ask the patient regarding the various movements of the muscle. Contraction, extension, flexion, extension, all you have to do the different movements of the different muscles. These actions are feasible, whether it is very good for you and appropriate for the healthy muscles. However, in the case of muscle wasting or atrophy, the strength and efficiency of these muscular movements is compromised. Now, after this clinical examination, you can do some investigation which can give some clue for your diagnosis. If you do the serum albumin and globulin, these two things can be considered as मांस पोषकांश, इसको हम कह सकते हैं. अल्ब्यूमिन ग्लोबुलिन ठीक है, हाँ, तो आपके शरीर में मांस धातु विल बी ऑल राइट, द नरिशमेंट विल बी ऑल राइट. सीरम अमाइलेज, ये मांसग्नि स्वरूप में इस घटक का परीक्षण कर सकते हैं, ऐसे कई विद्वानों का मत है. सीरम अमाइलेज कैन इंडिकेट द लेवल और द ऑप्टिमल कंडीशन ऑफ मांसाग्नि, because Ayurveda says there is Jatlagni, Saptadhattvagni, and 3 Malagni. So total there may be 13 type of the important Agnis are there. Okay, I am sorry, Panchabhotika Agni, Dhattvagni, and the Jatlagni. I am sorry. Okay, so 7 Dhattvagnis, Panchabhotika Agni, and the Jatlagni. Total 13 Agnis. Tumor, for the tumor, it can be corrected with the muscle. The doctors always advise the biopsy, so that you get the benign arbuda or granthi. You can differentiate Putimans, gangrene, microscopic determination of Clostridium welchii you can do. So my dear friends, this is all about Mansavaha Srotas. This is a series. I have already uploaded Prana, Udaga, Anna, Rasava, Raktava. It's completed. Today Mansavaha completed. Now next will come Medha, Asti, Majja, Shukra. Everything will come. So please, please, please continue my support and continue. Like this video, share this video, and do not forget to press the bell button icon to get the intimation of interesting academic and clinical and research-oriented best videos from Professor Deshpande on YouTube with the Ayurveda Academy channel. Thank you very much, my dear friends. I wish you all the best.